Depression is a very common illness in which people feel down, depressed and hopeless and take much less pleasure and interest in doing the normal things in life that they find interesting and pleasurable than they would do normally. And it goes on for more than 2 weeks, because we all have bad days when we feel a bit low, and if that goes on for a day or two, that's unfortunate, but it's life. Whereas if you have those feelings and they go on for more than 2 weeks, that's probably depression. I think we would tend to divide depression up into mild, moderate and severe, and mild depression is very common, and people can have mild depression and will often recover with some self-help measures that they can institute themselves over a couple of weeks. So it's very common in general practice to see someone who's depressed, and if you give them some simple measures to look after themselves, they will recover, and when they come back in a couple of weeks they're much, much better. Someone who's moderately depressed may recover with those measures or may need some help with under medication or talking treatment, whereas someone who's severely depressed almost certainly will need both medication and talking treatment to help them get better and help them stay better in the future. I think first of all, self-help is very important and applies to any sort of depression. Whether you've got mild, moderate or severe depression, you can help yourself, and there are common things to do that are very sensible. If you're smoking too much, don't smoke or try and reduce your smoking. Don't use alcohol as a drug, because it's a very bad drug and doesn't necessarily help your mood at all. So you ought to reduce your alcohol intake down to or below the recommended maximums of about 21 units a week for a man or about 14 units a week for a woman. And certainly you shouldn't be using street drugs to try and help yourself feel better. People can, for example, smoke cannabis thinking it will make them feel better, when in fact it usually tends to make depression worse and isn't a good idea at all. Eating plenty of fresh fruit and vegetables, eating well, will tend to make you feel better, and exercising is absolutely vital. Exercise is a really good way of feeling better about yourself, and it gets you out. In general practice, about 7 out of 10 people with depression actually come and see their GP with physical symptoms. They might have headaches, backache, tummy aches. They may have alterations in their appetite, be losing weight or gaining weight. They may have difficulty sleeping, and see that very much as a physical symptom rather than something that's at all psychological. Often other physical symptoms people can have can be loss of the normal physical appetites that we all have, like for food or for sex, and people can lose those completely and lose quite a lot of weight when they're depressed. If you're worried about whether you might be depressed or not, you could reflect on how you're doing at work, or whether you're maintaining your friendships or not. Are you bothering to ring up your friends, or are you waiting for them to ring you? Are you taking an interest in your family? When did you last do something really special with your kids? Often people who are depressed will do none of those things, and that's very sad. If someone hasn't responded to those self-help measures after a couple of weeks, if they're mildly depressed, or if they've got moderate depression, then the time comes that you need to have a discussion with a GP about active treatment. And there are two sorts of treatment. You can either have medication or talking treatment. And traditionally, medication was the main treatment that was available. It's easily available in the GP surgery. I just have to write a prescription and the patient can go off and start the treatment right away. Talking treatment used not to be available so widely, but now with the Improving Access to Psychological Therapies programme that's being rolled out across the country, there's more and more talking therapy, especially cognitive behaviour therapy, available really quite rapidly in more and more places in the country. Sometimes people can feel absolutely desperate when they're depressed, and they can have thoughts of harming themselves. Now, thoughts of self-harm are very common when you're depressed, but occasionally people can actually go on and make plans or start taking actions to harm themselves, to perhaps kill themselves even. And it's a good idea to plan with your doctor what you might do if you ever get those feelings. So you could, for example, write down on a piece of paper the phone numbers of the 5 people you're going to telephone if things get really bad and you feel quite desperate, because usually at least 3 of them will be out. So you need 5 numbers to make sure that you catch somebody who's in. And you could also perhaps put down on the list as well your GP's phone number and also the phone number of the Samaritans, so that if you're feeling absolutely desperate, you know what you're going to do before you get there.